Okay. Well, welcome to another episode of the PICS Trailblazers series. It's my pleasure and honor to introduce you, Z. Dr. Hijazi. Ziyad Hijazi actually don't need any real introductions. He has international fame as a pediatric interventionist. I don't think there's a single pediatric interventionist who does not know your name.
Thank you so much.
He trained with Bill Hillenbrand at Yale and started his career in 1991 at Tufts Medical Center in Boston, where he became director of the cath lab and subsequently chief there. He then became chief at the University of Chicago as a pediatric division, pediatric cardiology division, followed by the same role at Rush University in Chicago. Then he became the inaugural chairman of pediatrics in Sidra Children's Hospital in Doha, Qatar, and then became the big shot chief medical officer there and until late 2023. He's now stepped back from that role and is a part-time consultant there. So welcome, Z.
Thank you, Frank. Thank you for this kind introduction.
All right. So I have some questions for you. Now, we all know that there's a catheter, a balloon catheter named after you called the Z-Med. Tell us the history and how that developed.
Thank you. Thanks, Frank. It's two catheters, the Z-Med and the Z5 and Z6.
That's right. That's right.
So the Z-Med, as you mentioned earlier, I trained with Bill Hillenbrand. Back in 1989 and 90, there was an engineer and owner of a company called Numid.
Right.
Mr. Al Tower used to come and work with Bill. So I met Al as a student, as a fellow. And then when I finished my fellowship training and went to Boston, I contacted Al. I told Al I have an idea for certain, equipment. Among them is the Z-Med balloon as well as the Z5. And of course, we did the animal work in Boston. And then, of course, the company did a phenomenal job to take it all the way to the FDA approval.
And everybody has the Z-Med balloon in their cath labs. So thank you for that contribution. Z, I know everybody knows you started the PICS Symposium back in the 1990s. Tell us how that happened and how did you come up with that idea?
That's a great question, Frank. So many people don't know that before this, I also co-developed a coronary stent. Initially, we developed this stent for babies with PDA to maintain PDA patency. And I did all the animal work, but then at the end I said, how many babies a year we're going to do with a stent? So I said at that time in the mid-90s, actually 93, 94, coronary stenting was in its early infancy. So I said, I need to test this stent in coronary arteries. So I did a whole animal trial, and of course we published this to see if this stent will be good for coronary arteries. And the results were spectacular. So the company that I was working with sold the rights to another company because they were not coronary stent company. And I traveled the world proctoring adult cardiologists on coronary stenting. South America, Europe, Asia, everywhere. And of course, because I was known in this field, Dr. Marty Leon, the director and the founder of TCT, started to invite me as a faculty in the late 90s, 96. So I started to attend the TCT. And then in 1996, I said, we have to have a meeting like this for pediatricians, for pediatric cardiologists. So you want to approach the famous people at that time. At that time, I was not known in the field of pediatric cardiology. I was just a beginner. So I contacted Dr. Jim Locke from Boston Children, and Jim said, this will fail. I don't want to have anything to do with it. But I asked him any advice, who should I contact? So he advised me contact a cardiologist by the name of John Hess. At that time, he was in Rotterdam. So contacted John. The same thing, he did not want to have anything to do with this.
Wow.
So finally I said, I'm going to go back to where my alma mater, Yale, talk to Bill and Charlie and see if they can partner with me. So I talked to both of them. They said, we will support you, Z, but financially it's your responsibility. I said, as long as you give me your names to be course co-directors, the rest I will do. So we did the first course in July 1997 in Boston, with total number of attendees and faculty of 87 people.
Wow.
And then we did the second course in 98 also in Boston. Then, of course, in '99, I moved to Chicago, and we moved the course with me to Chicago. But that's how we
I see.
started the PICS meeting, just because I saw the adults at TCT having their own meeting with live cases. I said, you know what? In pediatric cardiology, we need to have a meeting like
Yeah.
this.
Well, back then, I was a young faculty member. I actually participated in PICS number 3, I think. It was in
Yes.
Chicago.
Yeah.
So thank you for inviting me. But live cases were not a thing at that time. And the ACC and American Heart had lots of lectures and didactic sessions, but I just thought that the live session just made it a tremendous contribution to the learning
I
process
agree
because
with
it's,
you. I think,
yeah,
as you know, even now, I say to people that the live cases are the heart and soul of PICS, because we learn when we see something, how it's done, what our colleagues across the globe, because as you
yeah,
know, the live cases, not just from the US, we do it from Europe, from Asia, from South America, from Middle East, from everywhere. And every country has certain things. And we learn from every case
yeah,
that we do.
yeah. And the beauty of PICS is it's become so international that it actually became a forum, an opportunity to meet with people around the world, right? So over the years, I've become friends with people from
From
other
all over the
countries
world.
just
Yeah.
because we all
But we're
attended PICS.
fortunate that
Yeah,
50% of the attendance is US and the other 50% is
yeah, yeah.
outside the US.
Yeah, I thought that was a major strength in the symposium. Let me ask you, were there any significant moments or events during those early years when you were putting this all together?
Well, I mean, quite honestly, the meeting evolved to incorporate more of adult congenital, because initially we're just pediatric cases, but then as we advanced, we said, you know what, we'll do adult congenital and structural cases. So the meeting does have structural cases that are pertinent to the pediatric cardiologist, and as you can see from the meeting today and the live cases, the good cases, because the transeptal techniques, the mitral valve, the tricuspid valve, these are our valves,
Yeah, yeah,
so the meeting evolved from that. The other thing that we enhanced the meeting by involving nursing professionals, technologists, also in another language, Latin America, because we do a special session in Latin for our colleagues from Latin America.
yeah.
So these are the things that I'm very proud of, adding to the meeting year in and year after.
So you touch a little bit on my next question, which was the shifts and changes, the evolution for the last 3 decades. Um, Anything else that you can see that has sort of evolved to the current stage?
Well, I think education is extremely important for us. So the PICS meeting is one aspect of how we convey education to our colleagues, uh, but also we want to focus on our younger people, the people who are just finishing or not finishing yet their training. So about 4 years ago, we established the fellows course,
That's
which
right.
is not a new idea, because I established the fellows course for pediatric cardiology when I was the president of the SCI in
Right, right.
2008. But I thought that a PICS society, we have to have our own course for the pediatric cardiologists. And this year, we established what we call the Early Career Academy, which came to us as an idea from Gianfranco Botera from Rome. And when he pitched the idea to me, I said, you know what, this is no brainer. We have to have this academy. And we started this academy just during this meeting. And the advantage of the academy, it's a 2 year stint, 2 year, where 25 young individuals are chosen from at least 110 applications representing all 5 continents. They'll be mentored by five mentors and 70 faculty. Over 2 years, they will receive lectures, primarily webinars, but 3 times during the 2 years, there will be face-to-face meeting, twice at PICS, PICS US and PICS Istanbul, and once at CSI in Frankfurt.
Mm.
So I think this is a great opportunity for them to teach them not just techniques or knowledge, because you can get this from journals and from the literature, but also leadership, lifestyle, job negotiation, and all of this. So
Yeah,
it will incorporate everything that you face in your life.
yeah. And also, of course, fellowship is limited to 1 or 2 years, and there's still
That's
another
right.
few year of training processes that helps you gain experience and confidence. And so
Yes.
that early career is just as important as the formative, uh, formal training year.
Yep.
So
Yep.
that very, very innovative there. Um, how do you envision the future of PICS now?
So, as you know, we have a big course faculty, but more important, we have the course directors and co-directors, as well as we have the PICS Society leadership, the board, and all of them. And at one, already now we have specifically Damien and other people are heavily involved in putting up the meeting, the fellows course. We choose a couple of great faculty to head the fellows course on a 2 yearly basis. What I would like to see that more physicians involved, more nursing, more technologists come and attend the PICS meeting. And I always say to my colleagues, please bring your team with you, bring the nurses, the technicians, because they are the unknown soldiers that work in the cath lab. And it would be nice if once a year you bring them with you to see what happens in other centers. So I envision then the meeting to be slightly bigger. We don't want to be a huge meeting. 800 to 1,000 attendees in the field is good enough. And the community is everybody that comes to attend PICS always tell me that this is the best meeting that they go to because of how tight the relationship uh, among each other and the camaraderie between the colleagues and how easy to speak to a faculty. They see Frank Ing, they talk to you. Unlike big other meeting, TCT or the ACC or the HS. So I'd like the meeting to continue spreading the education, the knowledge for years to come.
And yet, I always thought one of the strengths for PICS is the international connections. Um, you've made attempts to collaborate with international societies. Tell me about that.
Definitely, the PICS Society, we're not in it to be greedy and say, well, we are the best on it. Every country has its own society. Every region has it. The American College of Cardiology, the American Heart Association, the SCI. These are all friendly societies, and we collaborate with them. And what PICS is doing now, we are trying to write guidelines, standards, but we don't want to write it US based only because there is the rest of the world. So we put writing committee to represent other societies outside in the US and outside the US so that we can come up with universal guidelines or standards that will help our
Yeah.
patients because what applies in the US may not apply in China or Korea or Middle East or South America. So to involve them in modifying such guidelines and standards to fit those regions is extremely important. And we collaborate with them. And now we just started to collaborate with APCASH, which is Asia Pacific, society. And this coming December, we will be in Hong Kong as a PICS society. We're sponsoring the event, and there will be speakers there talking supported by PICS. And the same thing, AppCash, they will also sponsor a session at PICS next year and strengthen the collaboration
Yeah.
between Asia and the US.
And you already have the PICS Istanbul,
That's right.
where you collaborate with
That's right.
Mero Kamanati and
That's right.
yeah.
We developed the PICS Istanbul simply for one reason because many of our colleagues cannot travel all the way to the US for many reasons, financial as well as logistic, because the visa issue sometimes is really troubling because many physicians are turned down visas. So we'll take PICS itself and go there and let our colleagues from Middle East, from Africa, from Europe, from Asia come and attend and enjoy the meeting.
Well, this has certainly become a global society in my perspective. So, question, what legacy would you want to leave the next generation of interventionists?
So when I die and pass away, I want people to remember the the nice person, the person that contributed in my education in life. And the best legacy you can leave is name. The best legacy you can leave is the people you trained and you
Yeah.
mentored. Those are your ambassadors in life and in life after death. to say, you know what, that guy trained. Number one. Number two, I want to help anybody who knocks on my door. And I have a lot of people who knock on my door. Can you help me get a training spot or something? I try my best.
Yeah.
So be nice, be kind to your colleagues, and spread your knowledge, and never say no, I can't, without trying.
Well, it's interesting. I was going to say that the one character I know about you, Z, is that you are the nice guy. You're really collegial, and you treat everybody with equal courtesy. Those that are above you, your peers, your students, and so forth. And one of the traits that I've learned is that when we contact you by email or text, you will always respond. Doesn't matter what time of day or evening, you will respond. And so, to me, that's a character thing.
And I encourage young physicians to be responsive also. Even when you are extremely busy, respond to your colleague, because I took the time to write something to you.
Yeah.
Respect me and take the time and respond.
Well, with that, thank you so much for this time, Z.
Thank you so much.
All right.
Thank you.
Thank you.
Thanks, Kamel. Thank you.
All right.